everyone, and welcome to our new episode of Cardiac Café. We're happy to be with you here today. We have a special guest who's going to be talking about My Heart, Your Heart. They are one of our collaborative partners that we're excited to highlight here with you here today. We have Eric Puroll joining us. He'll be telling us a little bit about what Project My Heart, Your Heart does, why it's important, what it does, and how it fits in with our mission at ForHearts Worldwide and the Pacemaker Club. I think at the end of the day, we're both working together to save lives, and collaborative efforts make a larger impact, and that's what we're here to do. So I'm going to turn it over to Eric. He's going to present Project My Heart, Your Heart, and we'll bring it together at the end and talk about how it fits in with ForHearts Worldwide. So Eric, thank you so much for joining us today. Do you want to give us a little introduction about who you are and what you do, and then you can get right into it?
Yeah, that'd be great. And thank you, Laura, for having me on. We're super excited for this collaboration to get started and save as many lives as possible going forward. I'm the project manager for Project My Heart, Your Heart. I've been the project manager for the last 11 years now. My role is to do the day-to-day lab operations, which includes all of the device reconditioning, as well as overseeing the international clinical trial, as well as the ICD FDA proposal and submission along with Northeast Scientific. So a lot of hats go into this role, but it is extremely rewarding, and I'm very grateful to be a part of such a wonderful project.
Well, you guys have been at this for a while, and you mentioned the FDA trial. I'm sure we'll hear about that in the presentation and the impact it's having on the device world, if you will. So we're excited to hear all about it and learn and talk to our pacemaker community about everything that you do and how and why we work together.
Yeah, and My Heart, Your Heart has been a 15-year journey now. So I was able to get in after 4 years of it kind of growing. And once we got FDA export approval to ship these devices overseas, it really is like we shot out of a cannon in 2018. So it's been really fun. A lot of work, but I plan to just go over what the need is, what the shared vision we have for our project, how we kind of set the backbone of, is this project necessary and how can we kind of sustain it? And then kind of how the lab came to be. We are the only reconditioning lab in the world, to my knowledge. We're unaware of anyone else who's doing what we do. So I think it's cool to kind of highlight how the lab has grown. And I'll walk you through the reconditioning process that a pacemaker has to go through from donation all the way to final sterilization. And as you mentioned, I'll end the talk with where our impact has been, what our impact will be going forward, and how our collaboration will increase in the years to come.
Wonderful.
Yeah, so there's an absolute massive need for cardiovascular pacemakers across the globe. And cardiovascular disease compromises about 30% of all deaths in the world, and it's extremely severe in low and middle income countries, where over 17.5 million deaths are due to cardiovascular disease worldwide. And 75% of those occur in low and middle income countries, where we can have the greatest impact. The disparity especially is high in the EP field. Costs are everything in EP, and the technological aspect of electrophysiology is hard to replicate in underserved countries. And you're only seeing 4 per million in Bangladesh, even lower in some of the countries that we are able to import our devices to. And honestly, the biggest hurdle for these patients is cost. A pacemaker costs anywhere from $25,000 to $5,000 here in the US. We have health insurance that can cover almost that entire cost. Same with leads. Leads are anywhere between $800 to $1,000. It gets even more exorbitant in ICDs and CRT defibrillators. Those can cost up to $45,000. And someone in Sierra Leone makes 15 cents a day. They don't have health insurance. They have to pay for the diagnosis. They have to pay for the visit. They have to pay for every single piece of the pie to get that device. And it's a lifetime or more of savings that the family would have to sacrifice for something that we take for granted here in the United States. So the cost is a major hurdle for these patients. And if we can cut out the major cost of the device, they have a much better chance of being able to get it and have good outcomes for the rest of it.
Yeah, I'll make a little note there just from our perspective from ForHearts Worldwide. That is one of the cornerstones of our mission is cost and serving the patients who can't afford. But also, I think we need to remember, you mentioned it, and I just want to highlight it, is patients sometimes spend their life savings to try to get these devices. And so that's where a program like yours and mine can come in as well to keep that from happening. There are the patients who may be borderline, and we don't want them to fall into poverty just to try to maintain their health. So we also provide devices for those groups of people who that may be the case for them.
Yeah, you hit it the nail on the head with that. So what is our vision? And the vision that you and I share is to extend the care to patients in low and middle income countries who would otherwise die from a lack of a pacemaker and hopefully ICD going forward. We plan to show that pacemaker reuse is safe and effective by performing a multi-center clinical trial, which we have been able to perform and reach enrollment at, which I'll discuss later. And then, like we've begun here, is to collaborate with any and all interested parties to reach all areas of the world that are in need of our devices. So, kind of a first brief introduction into ForHearts Worldwide. This has been a partnership that's been ongoing since I was even a part of the project. So it's been fun for me to kind of grow into this role and get to know you, Laura, and your brother as we go forward. And really, ForHearts is provide access to life-saving care for those that cannot afford it, which is identical to what we're trying to do. And you guys do a phenomenal job of developing extensive policies overseas and getting credentialed ForHearts centers that will be able to utilize the devices that we are able to recondition. So it's really a lock and key fit that is absolutely perfect. And now that we have philanthropic approval to donate devices, our collaboration to save those in need is only going to grow as those requests come in for devices. So there's been a long road to get where we are, and it really had to start with showing that My Heart, Your Heart was something that was necessary in the world and that there was a positive view into the impact that it might have on those patients. So we did a survey of funeral homes, we did a survey of patients, we did a survey of other fellow EP members at Heart Rhythm Society to see whether this was a project that they would be willing to donate, be willing to implant reused devices, willing to donate their device upon their death. And the vast majority of everyone that was surveyed, whether it be a funeral home director, patient, physician, they all believe that reuse can be safe and feasible. And all of this information was kind of gathered before we really dove into getting a lot of donations and kind of getting that FDA approval. So we've kind of set the backbone that this is a project that is positively viewed and that is something we should pursue into the future. So the next step was to see, okay, let's get donated devices, and will we even be able to use these devices that were gathered from deceased individuals from funeral homes? And this was done in 2011. I think it's changed quite a bit since then, and I'm hoping to dive into that in the next few months. But essentially, we need a longevity that's greater than 4 years. And what would the yield be from donated devices? And back in 2011, 2012, about 16% of donated devices had sufficient battery life, which they deemed at the time to be worthy of the cause to get as many devices as possible. I can tell you now that percentage has increased as devices have come a long way since 2011. A device now has a battery longevity of 15 years. We get devices that have 12 years remaining. I would say about 30 to 40% is what our yield looks like now. We've gone through 85,000 devices here in the lab for longevity.
Wow.
And we have at least 8,000 devices that are eligible for reuse with the minimums of 4 years remaining on them. So the devices are no longer our limiting step, which is awesome. There are other limiting factors.
Right. And I know you'll dive into those. And just quickly, the longevity, I think, is an important part to bring up, because when I talk to people about the project and the collaboration, that's one of the first questions we get. It, quote, is it worth implanting these devices into the patient? Because obviously with any procedure, there are other things to take into consideration, health and safety and infection and all of those types of things, which I know you'll hit on a little bit later. But I think it's just really important to point out now that battery use and the longevity of it was one of the first things that was considered to make sure the rest of the project fell into place around that, and that it was, I'm going to use the term, worth it. I think we have to say that with a grain of salt, because we are talking about people's lives. So worth it to you and me and the person next door may be different. But at the end of the day, it's about saving a life for as long as we can.
And it's always worth it. And I think 4 years is a great cutoff. And we're in a great position now where I can be even pickier. And I think 4 is the very low threshold I have for a device. We're sending devices that have 8 to 10 years of life remaining. And we have that capability thanks to so many device donations that come.
And you have that process, which you'll talk about also about how you determine that, which I think is really important as well. So
sure. One of the major kind of hurdles that we had to be addressed was, is this ethical to do? Since we are taking a device that's deemed unsafe and unfit for reuse here in the United States, is it ethical to do this and send it to countries that don't have the care or the ability to get a new device? And we wrote a great paper on this, and it's available on our website. I'm happy to share it with anyone who wants it. But we came up with the fact that this is a morally justified project that has conditions that have to be met throughout. And it's really about transparency, continued research, and I think the most important one, which is engagement and sustainability with the involved community. So we have to be transparent with the risks and uncertainties that go forward with these reused devices. We continue to tackle those unanswered questions every single day. The clinical trial is going to prove that as well, that it's safe and effective. We need to continue to do long-term research on these patients and continue to do research on ICDs, CRTs, just to show that the risks and benefits continue to be understood and continue to grow in the benefit direction. And I think engagement with the involved communities is the most important. We shouldn't just go into a place and say, here's your device, see you never. We need to be able to have an implanting physician on the ground be our source who does the implantation themselves. They are able to see the patient at the follow-up windows that are needed for safety. They're able to call the patient if there's a recall on the device. Sustainability is where we only need to provide the device to these centers, and they are able to do everything else with our guidance. We don't want to just drop it in and say, see you later, bye, if there's any complications or adverse events. We need to be able to follow up with these communities and make sure that they feel safe and secure when they get our implanted devices. And we do a very good job of all three of these.
Yeah, absolutely. And I think that's another place where our two organizations cross very well. That is, something that we were very adamant about as well, is the follow-up of all of our patients. Just due to the device itself and the way it works and the progression of disease. And because it is a battery, it does have to be monitored. It does have to be tested. It does have to be, settings have to be adjusted. There's a lot that goes into the treatment of a patient with a pacemaker, ICD, CRT. And it can't just be, here you go, good luck. It is an ongoing process, and supporting the patient and the doctor is as big of part of our missions as it is providing the device. And I think that's something that we need to.
That's right. That's just one piece of the pie, and we need to continue to make sure that all the pieces are being met.
Absolutely. Yes.
And then I'll just go through these. We did some case reports back then just to show that we could scale up and do a large scale international clinical trial. And these case reports really showed that there was no significant difference between a new device and a reconditioned device in the first 6 to 1 year follow-up window. So it kind of gave us an idea, like going to the FDA, hey, we did it with a small cohort. We're ready to meet a bigger cohort. So the journey to just the lab that I'm sitting in today has been an incredible one. Another 15-year journey. When we started, it was just that bench that you can see there at the University of Michigan. We were paying $5,000 for it. We couldn't do anything. It's wild that was all they had. We moved to World Medical Relief in 2018. Thank you to Dr. George Sampson. He gave us our space free of charge, and we continue to utilize it to this day. As I said, I think this is the only device reconditioning facility in the world, which is pretty fun to say and be able to set up. So that's what it looks like. We have a clean room for testing. We have an interrogation room. We have an overflow room for a lot of our devices we get from metal recycling centers. And we have a dipping room and a cleaning area. So you can see the lab's gone from just that bench to 4 rooms that are critical to doing the entire reconditioning process. And that's a quick glimpse of our interrogation room. That wall on the back, those are all eligible devices that are able to be reconditioned and go through the entire process that I'm going to speak about shortly.
Perfect. Yeah.
Yeah. And we officially opened in 2018. We named it after Sheldon and Marion Davis, who are very philanthropic donors to our cause every year. like I said, we've gone through over 60,000 devices here at the lab in this time. So it's pretty incredible the scale at which we can.
That's a huge number, 60,000 devices that you've gone through. Some have made the ones that were eligible, reconditioned, and those are getting out into the world now to save lives.
Slowly and surely. That's
Yeah.
right. That's right. So the reconditioning process was probably the biggest hurdle that needed to be overcome. This had to get FDA export approval. This took us about 5 years to get, and we worked directly with Northeast Scientific in Waterbury, Connecticut. They specialize in the sterilization process. So they're a huge, huge part of the puzzle. And I have to say thank you to them since they do it all pro bono. But there's really 4 phases to our approved our pacemaker reconditioning process. In phase 1, it's acquiring the donations from funeral homes, hospitals, private citizens. They ship the device directly to the lab that we pay for. And then we have students or myself who can sit at the programmers and interrogate those devices for battery longevity, our main factor in limiting what we are able to recondition. It has to have at least 4 years remaining. If it does, we remove patient health information, we turn the device off, and we enter that device in our catalog database so that we can follow the device wherever it may go in the process or wherever it might be implanted. I then have to remove the set screw and the screw cap by hand. So that's something the FDA said we had to do so that the header could get thoroughly cleaned. And then we put it in a quick little enzyme bath here in the lab. Once it goes through that, it gets sent to Northeast Scientific the first time. They do an extensive cleaning and decontamination process to it before they send it back to us in phase 2. And then in phase 3 is the set screw reinstallation so that we can do a detailed electrical testing of every single device before it goes further in the process. It needs to pass all of these tests that we put it through just to make sure that predicted behaviors are being met, pulse amplitudes are being met, sensitivities are being met. That takes us about 15 minutes per device. And then the screw cap has to be reinstalled as well. We do that with a silicone dipping process that takes about 2 days and 4 dips for each device. Once phase 3 is done, I ship them back to Northeast Scientific where they undergo an ethylene oxide gas sterilization, and then they get packaged to be exported wherever they need it. And that's honestly the most important part. It gives us a 1-year post-sterilization expiration date, as well as a for export only label. And that's the FDA needs to see that on every single device. So it's quite the process. There's a lot of steps involved. I would say from donation to complete reconditioning, if we were trying to fast track a device, it takes about 1 month. So we try to give ourselves a 2-month window to get devices prepped and ready for shipment for reimplantation.
That was going to be my question. And obviously it's a very manual process as well.
It is very tedious, time consuming, but so very rewarding when you can save someone life. So and we are in the process of creating some stock inventory. So we're prepared to help anyone much quicker as we go forward. That's just a picture of our old silicone dipping contraption. It could only hold 27 devices at a time. Our goal is to try to upscale as much as possible to meet the demand. The next photo will show you that we have, maybe it's not there anymore, but essentially that's gone now. And now we have a massive contraption that can hold 120 devices. So we can dip 120 at a time. So we are ready to meet the need as it comes up. Yeah. So all of this was in preparation for an international clinical trial, which the FDA deemed necessary to prove that this was safe and effective. It is the only kind of clinical trial to ever be attempted of its kind, looking at new devices versus reconditioned devices. It took us 3 years to get the University of Michigan to approve the clinical trial as we were the coordinating center. There were a lot of pieces involved. Essentially, the objective is to show that pacemaker reutilization is safe for underserved countries. It was a randomized, multi-center, single-blinded, non-inferiority study. So essentially, we are just making sure that the new devices and the reconditioned devices did not have statistical significant difference in infection rate and software malfunction rate. Our main goal is to get 260 subjects enrolled, but we actually exceeded our goal by about 100 patients, which is incredible. And they all had to be consented and to continue to come in for follow-up every 6 months until the device needs to be explanted for another one due to battery life, or the patient unfortunately passes.
And you're working with physicians in those study locations. I think that's important to note also that it's a collaborative effort on on all levels.
Yes. So we had 9 centers that contributed to the clinical trial in 8 countries. We had a implanting physician, principal investigator at each center who was responsible for the implantation as well as the follow-up. We were able to pay for all of the new leads, all of the new introducers, and the new devices for that arm and the reconditioned arm of the clinical trial. So the patient cost was next to nothing. They might have had to pay for some OR time, but these were the poorest of the poor patients in these countries that had to go through a social work attestation to make sure that they weren't trying to trick the system they were in. So that's who we were targeting for our clinical trial.
Amazing.
Yeah. And so our primary endpoints were freedom from procedure-related infection. And then our secondary endpoint was looking at freedom from software or any hardware malfunctions. So premature battery depletion, electrode malfunction, or unexplained deaths at 12 months follow-up. There were quite a few obstacles that we had to overcome for the clinical trial. We needed FDA export approval, which we've already discussed. We also needed to make sure that we got the University of Michigan to approve our clinical trial, which I discussed. And then we had to procure new devices as well as find centers that wanted to be involved. And thank you to ForHearts, they actually helped us get 2 of our centers in South America and Central America involved in the clinical trial. So we had to get a Ministry of Health approval letter from the country. That's kind of the main stepping stone so that we could import these devices. And we needed to also get local IRB approval from every single hospital or center that was involved. So it was quite a laborious undertaking to get all of the centers involved in the clinical trial. But once it was up and running, it ran unbelievably well. And we have reached our enrollment, and we are currently working on writing our findings for publication. Dr. Crawford, who's the director of the project, was able to discuss the 3-month outcomes at AHA last year. And then I was lucky enough to watch him present our 1-year preliminary outcomes at European Society of Cardiology as a late-breaking clinical trial. So there's been a lot of positive feedback. We're extremely excited to start the next steps. Yeah, that's just a picture of all of our enrolling centers. Mozambique, Kenya, Nigeria, Paraguay, Venezuela, and Mexico were our major sources of enrollment, with Escardio in Venezuela leading the way with over 100 patients, which was incredible.
Yeah. Okay. Amazing.
Yeah. And like I said, our enrollment goal was reached. We've been able to present, and now we're just waiting on the paper to be written. So we're excited to share it with them. And these are just some great pictures of Dr. Crawford in Sierra Leone helping patients. That's one of the first patients in Sierra Leone to ever get an implanted device, and it was one of our reconditioned pacemakers, which is very, very exciting.
And just to be clear, I want to make sure for every reconditioned device, there's a new one implanted as well. So that's part of that one-on-one aspect.
That's
so that
right.
you're comparing, I mean, for lack of a better word, apples to apples as much as
we can. That's
as
right.
you can.
That's right.
Yes.
That's right. Yeah, with the battery life is going to be quite different because the new device is going to have brand new battery, and that was known going in. We just want to make sure that the infection rates aren't wildly different or dangerously different, as well as any anomalies in the devices. And I can safely say so far, we've been able to prove that, and the paper will be able to highlight that with great depth.
Which is amazing. I mean, the results are incredible from what I've seen from the preliminary results. And I think that's just a testament to all of the behind the scenes prior to the study happening work that went into this project, and really looking at what has to happen to each of these devices to get it ready. And it's a very serious commitment, and it's a very methodically thought out technical approach to making sure that these reconditioned devices are the ability of them to save the lives is just as great as a new device.
Yes, well put. Yeah, and that's my favorite picture of Dr. Crawford with one of our patients.
So tell us who Dr. Crawford is real quick.
Yeah, Dr. Crawford is the director of Project My Heart, Your Heart. I'm lucky enough to be his right hand on the project. So everything runs through him. He's the face and the bones of it. Without him, we don't run as well as we do. So I'm extremely grateful for his passion, his dedication to the project, and his vision going forward. He's incredible. So we're very blessed to be able to work with him.
Absolutely. Yes.
So now that the clinical trial is wrapped up and we've reached enrollment, what are the next steps? We continue to do patient follow-up on those that are part of the clinical trial. We have gotten philanthropic approval, which means we can cut through a lot of the red tape and just donate the device to those patients who are in need of dire life-saving care. We are also working with centers who want to continue to do long-term follow-up and enter patients in a worldwide registry, which means we enroll the patients. They will only be able to receive a reconditioned device, but we will be able to do long-term outcomes research on these patients going forward. And we have already like 6 or 7 additional centers on top of the clinical trial sites that want to become involved in this and get reconditioned devices for their populations and continue to prove that the outcomes for these are a massive benefit to this population of people.
And that's one of the things that we'll be collaborating on as well.
That's
is
right.
enrolling some
That's
of our
right.
locations into that registry to ensure the longevity of our programming and support of our patients as well.
Yeah. The 15-year journey has been all towards this worldwide registry. So we are so excited to finally get it off the ground.
Yeah,
I don't know if I can't remember if the next slides talk about it, but essentially going forward, we have started the process of looking to get ICD export approval. And those devices have the defibrillation factor. So we have to be very tedious and make sure we are covering all bases of electrical testing. So those preliminary meetings have already started. There's like 6 or 7 of us that get together once a month to go over our progress and what needs to be looked at and submitted to the FDA to get that export approval. So we're hoping that proving that pacemakers are safe and effective will help streamline the reuse of ICDs, because everyone loves the pacemakers, but we get requests all the time. What about ICDs? What about ICDs? Because the cost is just 5 times greater when we get into these bigger devices.
And that's one of our biggest requests too from patients is ICDs. And they're much, much more difficult to get our hands on because of the costs associated with it.
That's right.
Moving forward with this phase of the project, as much impact as the pacemakers are having, it can only go up exponentially with the
that's a
ICDs.
whole nother diagnosis and a whole nother population of people that we'll be able to help save lives with.
Right.
So,
absolutely.
And just, I just wanted to highlight again our shared mission. Now that the philanthropic approval has been granted by the University of Michigan, we're only going to strengthen our collaboration. We work pretty much with the same populations of people. You guys have that network in place. We're going to piggyback off that network and help as many people as possible. And you'll help us kind of forge those partnerships in your centers that you've already created. So we're very excited to continue moving forward in the positive direction we have.
Yeah, as are we. Absolutely.
That's right.
Yes.
Yeah. And there it is, our shared goal. No patient should die from a treatable heart rhythm condition simply because they cannot afford it. It's almost criminal that happens. And I'm glad that we are trying to bridge that gap as quickly as possible for as many people as we can reach.
Absolutely.
Yep. And then we're continuing to improve this model, but we've put a good model in place, and I hope that we'll be able to continue to deliver devices that have been donated, evaluate them, get patient access, and continue to follow up going forward into the future. And it matters for so many reasons. It expands our access to essential cardiac care in underserved regions. It helps reduce preventable deaths. And supporting this sustainable model will allow us to give the device a second life, whoever donated that device a second life, by helping someone else going forward, and just continue to demonstrate that power of academic medicine, nonprofit leadership, and global partnerships that are only looking out for the greater good continue to thrive and save those that can.
And I've been using the term recently because I really think it's true that the services that we're providing in providing the pacemaker and the treatment and the follow-up, it's really generational, because the individuals that we're helping are people who are trying to work, people who are trying to support their family, people who are working towards sustainability for their personal lives and families. And the impact that it has is really, there's a large ripple effect around the patients that we serve. And I think that's really important to note as well, that when we help a mother or a father or even a younger person who otherwise wouldn't be able to finish school or start their career, those kinds of situations, we're really talking about generational impact.
Or even walk up the stairs without feeling short of breath. These are, once the device is in, it's an immediate effect on their well-being. It's insane.
Yeah.
So, and that's just, we can't do it without ForHearts and all of our collaborators. So It's really a grassroots organization that it's not about making money. It's about saving lives. I can't stress that enough. So thank you, Laura, for everything that your organization does. And I can't wait to continue to collaborate.
Well, we are thrilled to formalize this a little bit more and start to get your supply and your devices out into the world and the countries that we work in. I know one of the things that keeps me going on a daily basis is hearing about the patients that we serve and that we provide devices for. When I have the opportunity, which hasn't happened recently, but I hope soon, to meet our patients also, you really understand the impact that it has and the importance of something that we take for granted here in the United States. Access. Obviously, there are populations who struggle in the US as well, but the majority of people have the access that require these to get to these types of devices. And we will, from our perspective, we are looking at how we can reach the U.S. population as well in the future. But that will be a different project, and we're setting the stage.
That's a whole different hurdle to go.
Yeah. And we have to start at the beginning, just like you all did for this study. What's been like the most impactful part of this project for you on a personal level?
Oh, man, for me, it is getting the patient messages from our implanting physicians, and as well as being able to having the pleasure of meeting some of them in person who've been either at the meetings or traveled here to get supplies from us. Just the absolute gratitude and thankfulness they have for what we're able to provide really is a highly motivating factor to continue to help them. You forget that they're also underserved centers in some of these places. They can barely afford to keep the lights on. So anything that we can provide them to help their population, you get that scale when you're able to meet the physicians and how hard they work to save their people. It really just continues to motivate me and Dr. Crawford to.
I think that's a really good point. And when people ask me about ForHearts Worldwide and why we do it, I'm always reminded one of my favorite people that I've met working in ForHearts Worldwide is Dr. Meneses in Aguascalientes, Mexico.
Yeah.
He is a cardiologist there. He's been with our organization for 35 years. Implanting devices. He runs a pacemaker clinic where he has paid patients and also all of our patients that he has served. And he follows our patients as if they were his own and has adopted them into his program, and they become family. Yeah. And the words that he says is, he reminds us how lucky he is as a doctor to be able to serve his community. And I think, yes, the patients are the reasons why we do this, but we cannot do it without our collaborating physicians.
Impossible. And they are the gold standard of the best human beings out of all of us because they 100%. Have to put in the extra work above and beyond what they do.
Yes. Oh, I want to be him in my next life. He is just, and I think all of the doctors who work with us, I think all of the doctors who are in our locations, who are in your locations, they're doctors, and obviously they're doing it. It's their living. But when they take on this project, when they take on this other aspect, it's not about making the living. It's about serving the community. It's about providing for their people, their community, and that's what we're all about. And I think
it's a blessing that we're able to help them.
Yeah, absolutely. Well, we're excited. We want to thank you for everything, your work and your dedication to this project, to the study of reconditioned devices and the collaborative partners and partnerships that we have and will be building is just going to help us impact more people and save more lives. And that's at the end of the day, that is why we are here. And we can't wait I know I send you requests almost on a daily basis now. Do you have something for this patient? Can we get this patient a device? Do you have any other leads? Sometimes we get requests for people looking for open heart surgery or valves, or we may not be able to provide that, but perhaps we have a contact. And so I'm always, anybody who reaches out to us and to our organization, I try to find a way to help them. And these collaborations, these partnerships are how that happens. So thank you for everything that you all have done. We look forward to working more closely together and continuing our partnership and our collaboration. And we just want to say thank you, and we're excited for the future.
Same. Thank you so much.